There's a rising incidence of digestive disorders. There's an increasing burden on the U.S. and world healthcare costs to take care of people with digestive diseases. It's estimated that the cost for taking care of elderly patients, for example, in the next several decades is going to double. Urgently, better tools are needed to deal with patients who are afflicted with these often life-threatening illnesses.
New York-Presbyterian has really focused on digestive care. It's really coming together as a unit of people who take care of patients with digestive illnesses and being able to offer up everything from the latest in research to the latest in treatment plans.
Our vision is to dramatically improve the outcomes of patients who have digestive diseases. And what that means is, in no small way, to change the way care is delivered to patients with digestive disorders.
Really making a change in people's lives and being able to do that using all the resources we have.
The three main areas that we're looking to improve these are minimally invasive therapies.
You have new technologies that are allowing us to do new types of surgery, new types of procedures. Miniaturizing our ability to do surgery is an incredible advancement.
If you can take an 80-year-old lady who's sick with a serious problem and send her home the same day with just as good or maybe a better treatment, you got something big. Precision or individualized medicine. And this is where you take, for example, the tissues that might be biopsied in a patient, look at that individual's genetic makeup in those tissues, and then tailor the therapies that we're going to use to improve outcomes.
We can identify patients early, give them the right treatment, perhaps be able to understand who they are genetically by looking at the person's genetics, but as well as the family genetics behind it, and then being able to offer treatment plans before the disease becomes out of control.
Comparative effectiveness research allows us to know what advances we have made and how effective our new therapies are. The patient is getting the care that's most effective for them.
You've now brought experts together, you've brought technologies together, you've brought diagnostic plans together so that you're able to really understand the patient in every possible way.
And coordinating these efforts toward a common goal will take us to the next level with regard to patient care, reducing costs, and advancing science.
We're going to be able to cure diseases now that were felt to be incurable. We're going to actually move forward in technology, and we're going to lower costs. Patients are not going to need to stay in the hospital for a week. They're going to go home in a day or two with the therapies that we're prescribing now.
It's an exciting time to be in medicine. It's an exciting time to be here. We're going to be at the forefront.
We're not sitting back on our laurels like, oh, look what we've done. I'm not interested in that. We don't have time for that. This is not just an evolutionary, but really almost overnight going to be a revolutionary change in the way digestive diseases are treated.